medical experts. My name is Patrick Canty, and once again, it's my honor and privilege to host this event. And once again, we have to thank Ravi Shakamuri and Star Hospice Educational Services for making this possible. It's a great series, and we hope to do many, many more. Tonight, what we'd like to do is, this is a second installment of our discussion of all things diabetes. And what we're going to talk about tonight is, as you see on your screen, let's say, our last meeting, we talked about generally about the disease and the factors that lead to it and how you diagnose it and things like that. Well, tonight we're putting ourselves in the shoes of someone that says, okay, now I have type 2 diabetes. Now what? What do I do? And how do we treat this kind of thing? And so joining me tonight to help us kind of flesh out that subject are two wonderful physicians. They were here for our last meeting, and they're joining us again tonight. First is Dr. Sarah Savarzadeh Amiri, and then Dr. Suresh Prasad. Welcome to you both. And for those of you who weren't here last time, I thought what I'd do is turn it over to you, Dr. Amiri, first to tell us a little bit about yourself.
Sure. I'm an internal medicine and pediatric physician, and I currently work as a physician advisor at Odessa Regional Medical Center.
Great. Thank you so much. And then Dr. Prasad, tell us something about you.
So I'm internal medicine doctor. I'm also board certified in sleep medicine, advanced diabetes management, and obesity. And I have my own private practice. I have been practicing for the last 20 years in Odessa.
Thank you so much. Thanks for joining us
tonight.
Thank you. So let's start with this. I walk into your office, and I've probably seen you quite a number of times leading up to today, and I've been told I've got to change some things or I may develop diabetes. And now all of a sudden I've been told, okay, I have diabetes. So
okay.
Ravi, you're not muted.
Yeah, Ravi, we have.
నా దగ్గర ఫ్రీజ్ అయినట్టుంది కానీ రావడం లేదు అందుకని.
I think we're having some issues with. So what happens? Let's start out. Where do we go from here? Dr. Amiri, you want to start out?
Sure. So we'll talk about a little bit of the basics. We'll go through, we talked about the basics, as Pat said, at last session, but we'll just cover a little bit of it today for those of you who are new to join us this time. And we'll talk about really the management that it takes with regards to the diabetes, that it's a team effort. You, the patient, would be the most important part of that team. And we'll go through, what are some of the things that you have control over, okay, to do. And then we'll briefly touch on pharmacological therapy, so the medications that we would use, but that's the medications we'll cover at the next session, because that's a whole huge topic in itself too.
Right.
And so here we go. So I think the most important, and I think we've mentioned it a lot at the last session, is that every person, even though the disease is common to everyone, the process that you go through, your journey is unique to you as an individual. And that because it's a chronic disease, sometimes we get tired and exhausted, right? Mm-hmm. Just like anything else that you're struggling with, whether you're overweight or obese, whether you're not exercising and you want to start exercising, maybe alcohol or drug issues, anything, right? Anything in life that we want to do, if it takes a long time, sometimes it tires us out. So it's important to keep up hope. I think we talked about that a lot again at the last session, to keep up hope and start your day fresh. And even if you fall off the wagon, it's okay. Suresh, what do you think? Do you agree with that?
Well, I completely agree. Actually, it's a diabetes, as you said, is a progressive disease, and it's a chronic disease. And I think it's always every day. It's a unique disease that can affect almost every part of the body, and she will go over with those. And it is okay to cheat once in a while, but I think we have to come back to the basic and keep doing what you're supposed to do to control it. As I was talking to Pat yesterday, we cannot cure it, but we can certainly control it.
Absolutely.
And I mean, to that point, I think a patient's outlook dealing with any disease or ailment is an important part of how they deal with it. And how, I think more than any other, how the patient deals with diabetes and their attitude and their outlook, I think it really is a powerful part of the treatment, isn't it?
Absolutely.
For sure. And that, sometimes we have these misconceptions, right? Sometimes you think you got diabetes, that's it, right? I'm going to have an amputation, I'm going to go blind, I'm going to go into kidney failure and be dependent on dialysis. We can slow, even though it's a chronic and progressive disease, we can slow that progression. And not everyone has to end up at those end stage problems, okay? And that's really, really important for people to understand, because the fear that we have is it stops us in our track, and it's actually more harmful. So talk about it, voice that fear, express it to your family, express it most importantly to your primary care physician, right? To your primary care provider, and get rid of all of these misconceptions that you have. And so it's important to realize that. It's important to realize, as some of the basics on this slide say, is that there are many people that control their diabetes just by healthy eating and exercise. They're not even on any medications. So we call that diet controlled, okay? And that's possible. There are people that need medications, but you don't always need more than one medication. I've had patients that have been for years and years on metformin, and that's it. And that's perfect. That works for them. They work on their diet, they work on being active, they control their weight, and they do perfectly fine. And then there are, of course, individuals that need insulin, but again, there's so much we can do with insulin. We have insulin pumps. We have all sorts of different ways, different types of insulin to use. So again, you're not going to necessarily have to inject yourself multiple times a day. To prevent, the worst, you really need to start early. So it's important to know that type 2 diabetes has a prolonged period of time that you're asymptomatic. And we talked about that, Suresh, last visit, that about 8 to 10 years that you can be undiagnosed with diabetes. And so it's important to keep on track with seeing your primary care physician. Having a primary care physician is the number one step that you can take, so you can go for your regular routine visits. What else do you think, Suresh, we should?
Yeah. So
anything else you want to add?
Yeah, so majority of the time, it takes about 7 to 10 years to develop diabetes. But even if you have developed diabetes, you may not know about it. About 20 to 30% of the population who are diabetic, they do not even know that they are diabetic till they go to the primary care doctor, or they go to their other doctors, and they get their hemoglobin A1C checked. And we will talk about it. What are the guidelines? What are the numbers you should know? Beside ABC, what one hemoglobin A1C and fasting sugar you should know. But again, 20 to 30% of the population, they are walking, they are diabetic, they don't even know that they are diabetic. So it is very important for you to go to your primary care doctor and get your blood sugar and hemoglobin A1C and other testing done periodically.
And that's an interesting thing, because it's important, because we all know that it's one of those things that you can pass down to your family members.
Absolutely.
And so you could be a parent and may not have the healthiest of lifestyle. And this is not to be critical, but you may be doing things in your diet and in the diet that you're providing your children, and in the lack of exercise or the lack of healthy living, that causes diabetes in you, and you don't even know about it. And you're also basically setting up your children to develop diabetes as well. So not knowing, it prevents you from doing something about it that could help your children too.
And it's also, remember, children learn by the example. What kind of example that you're setting for yourself, the children learn, even though you don't tell them to learn. So we have to always behave at our home what we do, what we don't do.
Yeah.
So if you take care of your diabetes well, I think, God forbid, if they do develop diabetes, they will also be more proactive about it, and they will take care of it.
That's a good point.
So yeah.
And developing healthy habits, right? That's important, because if your kids are seeing that,
Exactly.
you are taking time for yourself, I, like, as a busy mom, I can, my whole day can be taken up by doing everything that I do. And I can forget about taking time for myself, right? To exercise, right? Even if it's 20 minutes. So, and I fall off that all the time. Recently started it again, right? So and I'm carving that out. But what I see is that then my daughter is seeing me do what I'm doing and sees the importance of it. I don't have to tell her anything, but she's seeing that, what, mommy is taking time for herself, and that's okay to do, and that's healthy to do, and look what she's doing with it. So all of those are really, they really impress to our children. It's the same as, reading. If you want your kids to read, you read to them, and you start reading to them when they're babies, right? You're developing that habit. So even though the last 3 points in this slide, I really wanted us to stress, because sometimes, again, it's the negative thoughts associated with diabetes. Again, it's a very serious chronic disease. It can lead to really bad, horrible things, but at the same time, it's a disease. It doesn't define you as a person. You have tools, you have control. We want you, the purpose of these sessions are really to help you feel empowered to take control of your life with regards to the disease processes we talk about. So in this session, we're talking about diabetes. And you can really live a very fulfilling, happy life despite having diabetes. I think both of us have been in practice long enough that, we've had lots of success stories, right? We've had patients that have cried because they got diagnosed with diabetes or pre-diabetes, and they were trying to avoid it, or it was a complete surprise to them. But they were pre-diabetic. I've had patients that have reversed it, and then, or they're diabetic and they've maintained their levels at a good level, and they're leading a healthy life. So I think that's really important for us to, again, stress. There is hope.
Super.
Agree.
And Suresh, do you want to go through like some of the risk factors quickly?
Yeah.
And again, this is something we talked about last visit, but for those who are new to us.
Surely. So obesity is one of the biggest risk factor for diabetes for children if the BMI is more than 95 percentile, or for adult if it is BMI, body mass index, is more than 25 for Caucasians and African American, but 23 and above for Asian American. Then it's considered obesity. So that is a humongous, that is probably the #1 risk factor, I would say, beside the family history for development of diabetes. Diabetes type 2 runs in the family. If you have one family member, one parent is diabetic, then chance of you developing diabetes is about 50%. If your both parents are diabetic, your chance becomes almost 90+%. So positive family history is very important for as a risk factor for type 2 diabetes. It is a lot more common in the Native Americans, Blacks, Hispanics, and Asians. Last time I was talking about in the slide that if you are Hispanic women, about 50% chance of you developing diabetes. If you are Black, your chance of is about 40%. If you are Caucasians, your chance is about 33 to 35% chance of developing diabetes. So it is basically we can call it like a pandemic. It's not only in this country but all over the world. The female sex, the girl has somewhat more chance of developing diabetes than the boys, like 1.3 to 1.7 times more likely. Fat distribution, that's very important. If you have a central or truncal obesity, or more abdominal fat distribution, then your chance is higher. If you have a sedentary lifestyle, smoking, if you're sleeping for less than 6 hours, and being a sleep doctor, I can tell you, I recently got again recertification in my sleep, and there was one whole page, a whole chapter is about the sleep medicine, and about how it impacts your sugar and your other metabolic profile. So you should sleep for about 7 to 9 hours. That is a recommendation. If you are sleeping for less than 6 hours, the chance of your diabetes also goes up, or impaired fasting glucose and insulin resistance goes up. And that ultimately lead to diabetes type 2. There are certain conditions that are associated with the diabetes. Those are like if you are birth weight was low, or you had a high birth weight during like when you were born, if you are a premature baby, or if you have gestational diabetes, or if you also have polycystic ovarian disease, or there is a chance of higher insulin resistance and higher chance of having developing diabetes. There are some dietary patterns that you should know, like, we all are used to having the Western diet. Like we consume a lot of red meat, processed meat, high fat dairy, sweets and dessert. Like, without knowing, we eat a lot of those, what we call is Western diet, pizza, pastas, and all those things. And that definitely lead to high sugar, high weight gain, insulin resistance, and then again, type 2 diabetes. There are certain things like sugar sweetened beverages. And again, I had talked about it last time, and I'll emphasize one more time this time. If you drink one Coke a day per day, you gain about 16 pounds of weight in 1 year, just one Coke per day. One Coke has about 8, sugar, 8 teaspoons of sugar in there. So that is really, really huge. And I would absolutely encourage every diabetic patient to not even buy any sweetened beverages. Vitamin D deficiency have been also associated with diabetes development and chromium deficiency. If you are eating grains, like, you should eat whole grain, cereal, fibers, nuts, dairy products with a low fat, fruits as much as you can, coffee at least in moderation, about 2 cups of coffee or caffeinated beverages. They have been shown to reduce the risk of diabetes. There are certain medications that you cannot, it's up to your provider, like, systemic glucocorticoid medications like prednisone, like those thiazide diuretics, and some antipsychotic medication has been also, they can make your blood sugar go up. So these are the basic risk factors. Beside that, there are several others, but I just thought it will be, for general public, it will be good to know. Like the obesity, in my opinion, is the humongous. That is the most important risk factor. I cannot emphasize enough. So I think it's very, very, very important to try to lose weight and try to maintain the ideal weight if we can.
That's perfect. And that's, those are the things, those are the risk factors that were identified. Those are what we use, your primary care provider would use to decide whether they're screening you for diabetes, right? So if you're sharing with your provider that, you have a family history of diabetes, if they're checking your weight, right? They're checking to see whether you're obese or not. Those all come into it. So this slide, which is from Up to Date, shows, when we consider, these are guidelines to providers, and guidelines are only guidelines, right? So again, your provider knows you best. So they may decide to even screen you earlier for some reason or other. So because every individual is unique, but generally we use these guidelines. If a patient, as Suresh said, is in that high risk ethnicity category, it has family members with diabetes, already has other chronic conditions that contribute, right? High blood pressure, coronary artery disease, so heart disease, has high cholesterol, women with polycystic ovarian syndrome, all of that comes in. Generally, if you don't even have any of those, we should really, you should really be considered for being screened for diabetes at age 45. So at the minimum, and I feel like a lot of people, they don't have to even wait until 45. You'll fulfill some of the other ones, right?
I think that underscores, I've said this before in other discussions, this underscores, if you don't have a primary care physician, if you don't have a family doctor, you need to get one, because if you have your family doctor that you go to, they're going to do that annual physical, or they're going to say, let's do some blood work on you every quarter or once a year, twice. And that's where you start surfacing these things, and you can do something about it. And but if you just go to the doctor when you're sick and you really don't have a doctor, and you just things are going to happen.
If you're going for and if you're going for a sick visit, I mean, sometimes people they get false reassurance because they go to a sick visit, whether they're going to the emergency room or an urgent care. And generally, as part of the routine care, we do ask these questions. Usually, a lot of times, even the medical assistant, when the person that's rooming you, will ask you about your family history. Will input some of that information. But if your visit is just for something that you needed today, right? You're sick, you have a sinus infection, you have a cold, you have whatever, a hand pain or a joint pain. That's what the visit is about. So that's why it's so important. I'm so glad, Pat, you said that, to have a primary care physician. And you don't have to see them often, right? It's if you're healthy, once a year or once even every other year. I mean, for my young adults, it's every other year they come and see me. So other than that, but it's someone that you can rely on that knows you, knows your medical conditions. And that's really important.
Yeah, if you will look at the CDC guideline or other like other recommendation, they do recommend that if you are age 20 plus, you should have a screening done every 5 years. If you are 30 plus, you should go every 2 years. If you are 40 plus, you should go every year. Exactly. I just want to share one patient. I see him once a year. He's a very healthy young man. His hemoglobin A1C, I check it every time, it is like less than 5.5 or so. Last time he comes about last month, and of course, because of we all know what happened in COVID, his hemoglobin A1C has jumped to 6.7. So I said, Mr. So-and-so, now you are diabetic. He said, no, doctor, how can it be? I don't have any symptoms. I'm healthy like horse and I'm feeling good. The only thing is I have gained about 30 pounds of weight because of the COVID. I said, that's it. You gained 30 pounds of weight, now you're diabetic. So he said, I'm going to lose 30 pounds of weight. Would you not put me on medication? I said, if you lose 30 pounds of weight, I would not put you on a medication. So I don't have a follow. He has a follow-up in 3 months. But what I'm saying is there is a lot of things that can change your numbers. So it's very important. Hello? Yes. It's very important, as Pat was, it's very important that you go and see your primary care doctor periodically and get the blood work done at least once a year. If you're 40 plus, specifically, you should go and do that.
Absolutely. And then these are the numbers, and we talked about them at the last session, but these are some of the levels that we basically look at for diagnosing you with diabetes or pre-diabetes. The hemoglobin A1C basically is a number that tells us how controlled your sugar has been over the past 3 months. Versus if you're taking your sugar level at any random time or a fasting, it's just in 1 point, right? So at 1 point, the point that you had your blood drawn, we're looking at your sugar level in your blood versus the hemoglobin A1C, which gives us an idea of how controlled your sugar level is in 3 months. And that's a common question. Again, I get it. Patients come in, their hemoglobin A1C is high. Oh, doctor, I had a heavy dinner last night. Well, the hemoglobin A1C is for all of 3 months. So that wouldn't explain it. Right. So that's important for patients to know.
That's good.
And again, as Suresh said, just because you become above 6.5 doesn't mean we have to start you necessarily on medications. Right. So again, talk to your primary your healthcare provider. So I think now we're really going to get into the management, right? So number one, you're not alone. Okay, there are so many patients that struggle with diabetes, and it's a chronic progressive disease, as we've talked about, but you are not alone. You have a whole team of people, dedicated healthcare professionals that are there to help you no matter where you are. Here in West Texas, you have these professionals right here, helping you with that. It's important to know that out of all the team members I'm going to mention, you, the patient, are the most important, okay, in this team. You're the one who has diabetes. You're the one who has to live with it, right? You're the one who's suffering the consequences of it if it's not controlled. So it's your willingness to do something about it that's going to impact it. It doesn't matter what me or Suresh will do, right? How many medications we prescribe to you, it won't matter if you're not taking your medication or you're not telling us that, doc, I started this medicine, but it's made me feel this way and I stopped taking it. So that's important. It's important to communicate to your doctor that all of that information. any information you can give us, the better it is, and the more we can help you. You're making a lot of choices, okay? The choices that I make in a visit with a patient is over a 15-minute visit, right? If you're very uncontrolled and I have you come in more frequently versus I'm seeing you every 3 months or every 6 months, that's a 15-minute visit, 20-minute visit, okay? But you are, and the choices I make are with regards to, together, how we're changing your medications, right? Are we doing blood work, things like that. The choices that you make is what matters. It's, when or how you take your medication. Are you checking your sugar? Are you checking and doing something about it, right? If you're just checking it, you can check your sugar 10 times a day. I've had patients really check their sugars 10 times a day. I'm like, your fingers must be falling off. Please stop checking your sugars that often. But what are you doing about it and what does it mean, right? So that's important. The food you buy, I mean, we all have, there are a lot of limitations, okay? So we do have to consider that, but talk to your primary healthcare provider. Tell them that you're on a limited budget, right? Where do you shop at? I mean, that's one of the questions I ask. I try to get a sense of where people shop at, to get a sense of what their socioeconomic status is. And again, we can help. If we don't have all the information, we can't help as much. So it's important to tell us those things, and that again, you have control. You're still buying food, so it's just what kind of food you buy, how do you cook it. All of that matters.
We had just had a couple of questions from a couple of viewers that zone in on the what you eat and exercise. One viewer asked what foods increase T cell levels. The other one asked, does exercise lower BG levels? So I guess it goes directly to that.
Yeah, so we're going to talk about the diet and exercise. Suresh, do you want to take that? I don't know why they said T cell. Did they say T cells? The
T
first
cells.
question?
T cell?
Yeah, what foods increase T cells? I wonder if they were meaning the
for COVID. Are they asking about memories?
I don't know.
So actually, so there are two different kind of lymphocyte that we talk about, the T cells and the B cell. The B cell is basically that produces the antibody. Like, when you are taking a vaccine like COVID vaccine, for example. So there are two different kind of antibody that you will produce. One is the B cell, that is antibody. So as soon as your antigen comes in, antibody binds with it and it tries to kill it. Then there is another cell called T cell, that is a memory cell basically. T cell is basically a memory cell. Yeah. And that also comes from the lymph nodes that come from the blood system, this blood lineage. And those are memories also, so there is not a specific food that will increase the T cell. However, if you live a healthy life, if you do not become diabetic, if you do exercise every day, if you maintain your body weight, you will have a good immunity, and good immunity is as good as having good T cells. That's what I will say. So there is not a specific diet that you can, that will make the T cell go up. Having too much of T cells is also not good, because then you are talking about having leukemia, So having too much of T cells is also not good, but you want to have an optimal T cell. And again, the healthy lifestyle will do that. So that was the one question. We're not going to have a
run on Brussels sprouts at Safeway to get.
Yeah. And what was the second question, Pat?
Well, it goes to the question of exercise. Does exercise lower BG levels?
Yes, absolutely. Yes. The answer is absolutely yes. So yes, if you exercise is very important. And I would like to emphasize, you should not do exercise. You have to take in consideration, you should sleep when you are on certain medications like sulfonylurea, or if you are on insulin therapy. If you go and do exercise, your blood sugar may drop down. So yes, it does bring your blood sugar level down as much as 30 to 50 points. I have seen patients having hypoglycemia because they did not eat much, they did not eat well, they took their insulin and they have gone to do treadmill for 30 minutes, or they lifted weight for 30 minutes. So yes, it will definitely bring the blood sugar down. As far as the guideline is concerned for exercise, the ADA guideline says that you should do about 150 minutes of exercise per week, divided into 3 different weeks, 3 different days per week. So it can be 30 days, 5 days, or 30 minutes, 5 days, or it can be even 45 minutes, 3 days, but 150 minutes of exercise that is recommended per week. aerobic exercise when your heart rate is going up.
Right.
It's not like, while you are doing just a romantic walk with your husband or wife or dog, and then you consider it exercise. That's really not an exercise.
But if you pick up your pace, because this is the 150 is for moderate exercise. So if you pick up your pace and actually do fast walking, that'll count,
Yes.
right?
Yeah, absolutely, absolutely.
So
just that 30 minutes
not
fast walk.
30
You don't have to go
minutes.
to
And you know what?
CrossFit and crunch 400 pounds.
No, you do not.
Brisk walk. That's what's called brisk walking.
Exactly.
Brisk walking.
And I tell patients just start with even 20 minutes. Sometimes 30 minutes seems like a long time, just start with 20 minutes. And then the other advice I give is, start walking, and you want to start slow, right? If you haven't exercised at all, you're not going to start running on the treadmill. You're going to hurt yourself. So number one, always check with your healthcare provider, because if you have other chronic conditions, you need to make sure, what level of exercise you can start with. So talk to them, then start slowly and build up. You don't need to, from the first week that you start exercising, meet that 150. The goal is to reach there and then to maintain it. So you don't want to hurt yourself either. So then you're out of commission.
Right.
And start with 20.
It could also be as simple as, I know somebody at work, and instead of taking the elevator, they take the stairs.
Yeah, absolutely.
And my doctor once told me that. He said, here's a good one. You live in a 2-story house, go up and down the stairs a few times, and that helps. So
yeah. Or you
absolutely.
Go to we drive everywhere here, right? So when you go to HEB, park the farthest away. You'll protect your car also, and then you'll get extra steps in. And we all have these watches, right? We have all sorts of things that we can wear. Have a goal, try to be more active. So you definitely need the aerobic exercise, that's 150 minutes per week, but then also being more active, right? So right now I'm going to be sitting here for an hour, not such a good thing, So if you have a lot of people now wear Apple Watches or any other kind of thing that you might be wearing, it'll tell you, you've been sitting for too long, get up. And that's important, because nowadays, based on research, we know sitting still is as bad as smoking.
Right. But also, now correct me if I'm wrong, it also doesn't count if you say, well, I spend all day on my feet doing this and that and that. That's not the same as getting exercise.
It's not the same.
It's not.
Yeah.
I always tell my patients, I stand on my feet for almost 6 hours every day. Yeah. I'm walking from room to room while I'm seeing patients. That is not my exercise. That is my job. That is my routine job, right? Yeah. Exercise has to be dedicated structural movement of your muscles. I just wanted to talk about, go ahead.
I'm sorry. You need your heart to beat fast and you need to sweat. Right. So that's the aerobic part. If you're not sweating and your heart is not beating fast, you haven't reached that level, of the aerobic exercise. And then, but the exercise, as Troy said, you're walking around, I've counted my steps. It definitely doesn't add up to 10,000, when I'm just going from one room to the next. So that doesn't work. We need to be intentional about it.
So I get this question sometimes asked about for exercise, from resistant exercise, like resistance training, like, free weight and weightlifting and weighing machine and all those. So the recommendation, it says that if you make sure you do not have proliferative retinopathy in your eye, and that is contraindication for resistant training. And, so we always recommend that if you have severe coronary heart disease, like if you have triple vessel disease, or if you have bad heart, you do not want to do the resistance exercise. Right. But brisk walking, as much as you can tolerate, up to 150 minutes per week, is definitely a recommendation when you increases your heart rate, increases your oxygenation. But resistance exercise, you need to be a little bit careful, especially if you have severe coronary heart disease or if you have proliferative retinopathy.
Okay.
Yeah, especially the weight training and weighing machine and all those things.
Right.
Perfect. Right, so yes, so these are, if everyone can see this diagram right here, you the patient are the center, as we talked about, and then there's all these other team members in your diabetes care team that are there to help you. So you are not, again, the point of this slide is to say you are not alone. You have all these specialists. You have your primary care provider, that can be a physician or a nurse practitioner or a physician assistant, so they know everything about you, right? They're the one that you go to first for everything. Now, as your disease, when you start off, you might not have an endocrinologist. I mean, pretty much all primary care providers all primary care providers, we all treat diabetes, okay? So just because you have diabetes, because that's a question I get a lot is, oh, doc, I have diabetes now, so do I need to go to an endocrinologist? No. There aren't enough endocrinologists to see all the diabetics. So as your disease progresses and that, your primary care provider needs the skills of an endocrinologist because there is more complexity to your disease process, you're now on multiple medications, you're on insulin, there is a lot more complications, there's other things occurring, then you might want to go see them. So that's there. And that's why they're not initially in that inner circle. But as you can see, the inner circle includes your primary care provider. It includes the nurse that works in your PCP's office. It includes your pharmacist. They are such an important team member. They're the ones that get the scripts from all of everyone you see, okay? So sometimes we try to communicate with each other, but they're that second gateway of catching something. Maybe your cardiologist started you on something, or your neurologist started you on something, and that's interacting with your medications that your PCP started you on. They're the ones that are going to catch it. And this is another point that I really want to stress with patients, and I see that a lot, especially in this community, is that people use different pharmacies, okay? And when you use different pharmacies, you have some of your medicines go to one pharmacy and then others go to another one, not this within the same chain, but a completely different pharmacy. Those pharmacists no longer can be that checkpoint because they're not seeing everything you're being prescribed. So it's, again, extremely important. I almost say it, the same way as when you go to a hospital, like when you use an emergency room, I really try to advise patients not to emergency room shop, emergency department, ED shop, go to different, because they have your information, right? And so as you're having more problems, it's easier for them to catch something that could be related to another problem you had before, okay? So your medical history is really important. And then, as you can see, the inner circle also, of course, most importantly, includes your dietitian. And that's hard because not everyone can see a dietitian, but they're one of the most important members of your diabetes team. And in our area, we definitely have them. So, the hospitals provide services for that. So it's very important to make time to see a dietitian.
Yeah, actually, just to reiterate how important it is to see a dietitian, there was article published about 7-8 years ago. And they say that if you see a dietitian once a year, you can bring your hemoglobin A1C down by 1%. That is a statistically significant number. Very important, so it's always important to follow diet if you're diabetic. And as we started saying that it's not a death sentence, you can certainly control it. You cannot cure it, but you can certainly control it. And seeing a dietitian and following diet is very, very important. Also, like nowadays, all of us, we have mobile phone. There was a data that has shown if you just download fewest app on the diabetic education, it can bring your hemoglobin A1C down by 0.5%. Just adding some, interacting with those apps, like diabetic apps, that almost everybody has a smartphone these days, It's very important to download some of those, diabetic education program.
Okay. So this is a great question that just came from a viewer, and it touches upon what we're talking about, a dietitian, but it's also going to touch upon what we're going to talk about as far as communication. And that is, what are the questions I should ask my dietitian?
Oh, great. Of your dietitian specifically. So the question, it's going to be more a discussion. You're going to get to spend a lot of more time with your dietitian. And they're going to take a lot of information from you. So they're going to go through what do you eat, right? So you're going to keep a diary. What do you eat for breakfast? What do you eat for snacks, right? In between, are you a snacker? What do you do when you want to snack? What are your tendencies, right? So I love salt, so I go for the salty snacks, right? Other people go for the sweets. So they get into all the nitty-gritty details. And sometimes people are scared to go to a dietitian because they're not going to understand because I am vegetarian or I eat Asian style food, or I eat, cultural, they're not going to have that understanding of the cultural impacts of the food that I'm eating. But that's not true. That's why they have to get certified, right? They go through this training certification process, and they're culturally sensitive. They understand that we all, the West Texas diet even is going to be different than the New Yorker diet, okay? And it's the same if you look at all around the world. And so it's important to really be honest with them. You don't need to, and they're not going to tell you, you eat, I don't know, like they're not going to tell you if you're vegan to start eating meat, right? Or if you never eat bread, and they're going to tell you to eat bread. Like, it's not going to be that way. So they're really sensitive to that. And as we talk about diet more, I'll even show you more resources on the ADA website. That's a really good website for patients to go to for information about diabetes. A lot of the information that we're presenting today is coming straight from them. So it's written in a way that most people are going to be able to easily understand it. And it gives you a lot of action points. What can you do, right? You're not going to need anyone else. This is under your control on what you can do. So it's going to be a lot of storytelling. Yeah. And then you can tell them, they'll tell you how to make tweaks, right? Small tweaks can actually be so impactful. So you don't have to make huge changes necessarily. And so that's why they're there.
I thought it was so, I actually I was sent to a dietitian once. Perfect. And it was really, going in was very awkward and embarrassing, because you feel like, oh, I'm going to a psychiatrist and I'm gonna, and it's like, oh, but it was so amazing the way the woman talked to me and learned. And basically it was like, well, I learned how to eat all this great crummy food that's really bad for me. And she wasn't judgmental, but she was just helping me very compassionately, like, I'm on your side, bud, and I'm going to help you learn how to eat the right types of foods and the right amounts of them. And it's really not that hard. And here are little tips and everything. And I felt so good after I left. It was like, why did I feel so embarrassed going, it's like, making sure no one saw me walk into the dietitian's office,
No, it's absolutely true.
It's a great experience.
And then you also need refreshers, right? So a lot of times, like for my diabetics, I'll tell them, you'll see a tendency sometimes, people's hemoglobin A1C might be trending up, or you just, they even admit it to you, right? Like, I'm not eating as well as I used to eat. There's a lot of information out there, and there's a lot of information that's always coming out new. So it's okay to go. Like, I refer back my patients to a dietitian or a certified diabetes education specialist. And they're like, no, I've gone to them. I'm like, when did you go to them? And they're like, 5 years ago or 2 years ago, or even a year ago. I'm like, you know what? Go again, because it's helpful. It's the same as actually, Pat, mental health. I think we all should go, have a session with a psychologist. But yeah, for sure, it's really important. And to be honest, right? If you're going to go in there and just, not be honest about what you actually eat and put in your body, they're not going to be able to help you. So be honest.
And I think it's important for the patient to be honest with you, the doctor, too. Because I'm sure y'all have gotten the BS stories every which way but loose, like you were saying, well, I had that donut a month ago, and maybe that's why it's the way it is now. I don't know.
Well, I've had patients tell me that they've missed appointments, right? And they haven't come in. And then, so we try calling them when, you try to make every attempt. And then a lot of times I'll get on the phone and they'll say, yeah, I know I haven't been eating well. So I know my hemoglobin A1C is going to be like, through the roof. So that's why I'm not coming in. I'm like, okay, like, that's your conscience. That's like you, but you should still come in, because we can do something about it, right? Because what you're doing is you're delaying you taking action. You already know, right? It's not a surprise. It really isn't. To most patients, I really can't say that it's a surprise to them when we check their hemoglobin A1C in the office, or, they get their blood results back, that it's higher than it should be. They know. But it's another person, your doctor telling you, right?
It's just so
But
frustrating,
again,
it's
is.
frustrating for the
Judging you.
patient. It's frustrating for you, the patient, because it's like, well, I kind of got
And
myself
we're
into
not
this
judging
situation.
you. So we're not there
Yeah,
for the
no.
judgment, but we're going to ask you those tough questions. And
Yeah.
so we're grilling you, right? But we're not. We're just trying to ask you those tough questions to get into why we are
Exactly.
where we are and how can we change that underlying cause. And that's really important.
And I think that gets us into communication, which is, the slide here.
And I put it all
why
over
it's
the
just so important.
slide. Communication.
No, I agree. One question I just I wanted to just make one comment. Communication, as Sarah and Pat both said, is extremely important. And the reason I'm trying to say, I have some patients, Sarah and Pat, actually what they will do is they will write the blood sugar. They know the goal is 80 to 130, right? They will write 80, 90, 100, 110, 120, 130. And they will bring it for 3 months. When you check their hemoglobin A1C is 9, okay? So you said, it's very unlikely that you will have all those numbers in the round figure, like in a zero figure, right? 90, 80. So, you are not cheating. That is smart, but at the same time, the A1C does not, it's going to find it out. So you are not fooling anybody else but yourself. So it's very important, if you have not checked your sugar because of whatever reason, because you don't have strips, you don't have funds to buy strips, so they're not cheap, right? You have not been following that, you have not been doing exercise, you're not taking medication because of whatever reason. Don't fool around. Just go and tell them, hey, I have not been taking medication. We will start from scratch. We will do something different.
Well, that's the thing. I mean, and it's important to know because I've been there. I don't have diabetes, but I've been there with the weight loss and things like that, where you're just like, oh boy, I'm going to be in trouble when I go in this time and it's so important, whether it's something like that or diabetes, it's so important to realize that your doctor's not going to judge you. Your doctor's not going to, your doctor's there. He cares about you or she cares about you. And it's not something to put off or feel embarrassed about or nervous about. It is what it is. And they're going to be there for you, whether you fall off the wagon or you don't.
Yeah. We are on your side, we are on your side. Yeah. We are here to help, we are all, like yesterday we were talking about, it's like not just one person disease. It's like your entire family. It's the entire village, it takes you, it takes dietitian, it takes your family, your wife, your husband, your children, your pharmacist, your physician, nurse practitioner, PA, everything, right? So don't give them wrong information. If you have not done something right, just tell them, hey, because of whatever reason, I did not do it right. I'm willing to do it. And you are the one who has to take control. Nobody else is going to take care of it.
Right.
I'm spending 15 minutes time with you. You are spending whole entire life with yourself. Right. You are the one who's going to live with complications. Yeah, you are going to live with complications like blindness, amputation, dialysis. One question or one thing that I would like to bring it and just very clear. Most of the diabetics, they do not die because of high sugar or low sugar. They die because of the heart attack, congestive heart failure, a stroke. Okay, so if you don't think about my blood sugar is very well controlled. Why did I have a heart attack? Well, if you are a smoker, if you're drinking alcohol, if you're obese, if you have obstructive sleep apnea, if you have high blood pressure. So diabetes itself, it's a very, very comprehensive disease. Not like just getting a blood sugar right is going to take care of it. Whenever we talk about diabetes, we also talk about how we can prevent the complications like macrovascular and microvascular complications. Mm-hmm. There are certain medications, like if you are 40 plus diabetic, you should be taking statins, even though your cholesterol is normal, just to prevent you from getting heart attack. You have to take ACE inhibitors or ARBs, angiotensin receptor blocker, to prevent you from getting kidney failure. If you are, with a consent, patient consent, there are some certain time we prescribe aspirin to prevent them from getting heart attack and stroke. So it's not only getting the blood sugar is important, but also it's a comprehensive disease. A lot of lifestyle modification, and we are with you all. So we are here to help as long as you are willing to help yourself. You have to help yourself. If you are not willing to help yourself, you are not fooling anybody else by making those numbers up.
Right.
So
let's talk about these tips for communication.
to help with communication, right? How do you do it? So write down your questions. Okay, don't be embarrassed. And I have patients come in and they're like, "Doc, I have a list," and so I mean, I'm honest with patients. Okay, if you have a list of all these problems we want to discuss, we have a 15-minute visit. We're going to focus on your top whatever, right? Your top or 2 or 3. But if you're coming in specifically for your diabetes and you have those questions, write them down. If there's no harm and there's no stupid question, there's no dumb question, right. There's not too many questions. We can't promise we'll answer all the questions at the same visit, okay? So you have to be willing to, come in again, and that's okay, right? But write them down so you don't forget them, okay? And if you want to take notes, I have patients take notes. When I'm giving them an answer, they'll write it quickly so that they can remind themselves. There has been studies done on the amount of information that a person retains after like a visit, and it's ridiculously low. It's like less than 10% or something. Like, right, Suresh? It's like you don't remember more than 90% of what your doctor told you at a visit. Okay,
but
so it's important to write it
But that's
down.
an interesting point, though, because there's a lot of patients, they go in and they don't ask any questions, and they really don't pay attention to what the doctor's telling them, so they really don't understand what's going on with their health. And I always kind of think when I, I have a relative that older, and how did it go? Well, what did you say? What did he say? Well, it's like, well, that doesn't sound like a very successful doctor's visit for you.
No.
Because you're just kind of flying blind, and Lord knows you may not wind up following the instructions very well. There's nothing wrong with asking the doctor, I didn't understand that. Can you please explain that more?
Absolutely. As I said earlier, we are here to help. We are here to, we are in your side, whatever we can do to improve your own health, we are willing to do it. But at the same time, you have to help yourself to get help. Right. That's the bottom line. I always tell this quotation to everybody, you have to help yourself. Like,
Absolutely.
A lot of people will say, oh, I don't check my sugar. I said, well, when you came to me I have a lot of patients from Midland. I have some patients from out of town. I said, when you come to see me, don't you see the speedometer? That's how you know what is your speed of your car, right? Same way, if you have to check your sugar to know what is your sugar like. Hemoglobin A1C will tell me your average sugar in the last 3 months, before meal, after meal, while you are sleeping, while you're eating, while you're not eating. But you have to check your sugar. You have to do your part. You have to go and see your dietitian, your eye doctor, your dentist, your weight loss, exercise, like a lot of things. Just getting sugar control is not the diabetes itself. It's a very, very complex management.
Well, how big of a problem is it with kind of the patient that's been living with it for a long time, because they think they know it and they just get slopped, like, oh, I don't take my sugar levels. I just know when I need to take a hit. I need it when I take a shot. Oh, I just know. I don't fool with taking my sugar level. How big a problem is that? Where people they kind of tweak how they take care of themselves.
I would say it's very. Go ahead, Sarah. Go ahead.
So it's it's twofold, I guess. There are patients that don't do it, and they just don't do it because they don't want to, I guess, but there are patients that are maybe trying to save their strips because it's expensive, right? Yeah. And so but they know that, and I've had many of those, right? So they're trying to save their strips, but they're on insulin, and they have to check, and they just guess at it. Mm-hmm. So getting to that underlying cause is really important. There are very few patients that just don't want to, I feel like, because if they didn't want to, then they wouldn't even be coming to see you, right? They're making that effort to come and see you, sit in the waiting room, right? Come and see you. So I think there is always a reason why patients are doing that. And so to be honest about it and spend some time discussing it is important. And again, we're on your side. That's what we're trying to tell. We're not here to judge you. We are here to help you. We want you to live the best life that you can. And
there's a lot of advancement that has happened in the last 10 years. Like, we used to check our finger stick, like if you're checking 4 or 8 times or 10 times,
When
whatever.
I see the commercial where they just
Yeah, exactly. So now everybody has this continuous blood sugar monitor, like you can Freestyle Libre or Dexcom type or Guardian. You can just have it and you can check it as many times as you want. You don't have to pick your finger. Same thing with insulin, like the patients who are taking multiple shots. Insulin pump, they're very simple to operate. I'm not kidding. I have one Spanish speaking patient. I have several patients on this insulin pump. One Spanish speaking patient who does not speak a word of English. And you will be amazed to see how good she manages her insulin pump.
Mm-hmm.
So when we first, she used to, she's related to one of the doctor. She used to go to the emergency room with a low blood sugar, high blood sugar all the time. She has type 1 diabetes. So she was referred to me by the other doctor, and we put her on insulin pump. And even I was skeptical about that. So luckily I have nurse practitioner PA who are Spanish speakers. So they communicated with her and she's doing so beautiful. I'm so proud of her. Her hemoglobin A1C always runs below 7. She's like 78 year old. If she can manage that, definitely a young person who can manage that as well. So those are some of the really, really good success story. As I was telling you earlier, I have a patient whom I am following for last 20 years. And he used to be almost close to 400 pounds. He lost 160 pounds of weight. His hemoglobin A1C runs about 5.6, 5.7. And it goes above 6, you start panicking. He said, Doc, what other medication you want me to put me on? I will take this, I will take that. I don't want above 6. So these are a lot of success story that we see all the time. So it's not a death sentence. It's not a end of the life. You can certainly empower yourself and you can get your sugar under control. And technologically, there are so many newer medications that hardly have any side effect. They prevent you from getting heart attack. They prevent you from kidney failure. The diabetes medications, like when we were in medical school, we were talk about sulfonylurea, metformin, insulin. Now we have like 12 different class of medications. So I think it's very important to go and write all the questions, ask the right questions, and spend time with your provider and listen to them. We are here to help. They are all in your side.
Exactly.
We have all one goal. And by the way, the doctors are judged by your hemoglobin A1C.
That is true. We are judging it.
we are judged.
First slap on the hand for us.
We get the slap on the hand. Yeah.
So Dr. Amiri, at the bottom of the slide is interesting because you talk about activate your patient portal.
Yes.
That goes to having that primary care physician, and because nowadays you don't have to be technically savvy. It's so easy to have that portal and everything's there accessible to you and your doctor and the records and everything. It's amazing how that helps.
It is. And some patients complain when they have multiple specialists, right?
Yeah.
They're going to multiple different clinics. They might have different portals, and I'm not going to activate 5 different portals, 6 different portals. And I completely understand that. And there is work on their way. So I moved from New York State to here about 2 years ago. And so in Western New York, we had started kind of unifying. So it was one, portal, patient portal. Everyone was using kind of the same system, and everyone, if you went to a different hospital, it kind of imported everything. Okay. So we're working, that's all in the works. It just helps. It helps your healthcare providers to know more about you. The more information, there is also too much information, but the more information we have about you, the better we can help you.
Exactly.
So get it activated, and then you can input data into it. That's what I love.
Exactly.
I'll see a new patient, and then I'll document things, and then they remember that they didn't mention some of their past medical history or even family history, and they'll input it in, and it's actually made a difference. Like I've had patients that I have sent for example, colon cancer screening at an earlier age because they didn't tell me, at the visit, they didn't remember, or maybe they knew about, they didn't know about it, and me questioning them triggered, but they came back and said, oh, you know what? I have a strong family history of it. And based on that, I've actually done things. So it's important to really, activate that patient portal.
Right.
And if you're not, savvy with technology, keep a list of your chronic, conditions, your current medications. Again, that's a huge, huge one. Because patients forget about their, as needed medications that they take.
Exactly.
Medications can interact with each other. Okay, so it's really important for your doctor to know. Oh, I take, NSAIDs for my headache. Okay, how often do you take it? I need to keep that in mind, right?
Right.
Herbal supplements. Oh my God, the number of herbal supplements that can have not so good consequences and can have interactions. It's really important. So
Right.
hiding that information or not telling us, we're not going to judge you. Okay, right. We're not there to judge you. We're just here to help you. So it's important to give us as much information as possible, and knowing your ABCs. Suresh had stressed that a lot last visit. Know your numbers for diabetes, your hemoglobin A1C, your blood pressure, and your cholesterol. Sorry, Pat, go ahead.
So guess what? We're out of time.
Oh no.
So here's what we're gonna do. I think we're headed into diet, right?
We are.
We're headed into, right?
And we kind of talked about it.
Yeah, and so
diet, but we should talk about,
we're testing. So I think what we'll do is in our next session, I predict when this is all over, 3 sessions will turn into 5, will turn into 6, because there's so much to cover. But probably what we're going to do next session is we'll talk about medications to deal with this, but also I think what we'll do is we'll lead into the medications with things like diet and preventive things like foot care and things like that. Does that sound good with y'all?
That sounds great.
That's
Diabetes
great.
is a huge,
an hour. I tell you what, an hour flies
topic
when you're having fun talking with each other.
We did.
So, well, listen, I can't thank y'all enough. It's amazing how fast it goes, and we say, okay, we're gonna get all this in an hour, and sure enough, we start talking, and it just time flies. And I can't thank both of you enough. It's always wonderful to have y'all, and especially the kind of how you put the human side, the human face on this, as far as from the doctor's perspective, but also from the patient's perspective. And we're kind of all in this together, and we're all here to try to help each other. So I can't thank you enough for all that you do each and every day in caring for people in our community, but also taking the time tonight to help kind of educate us more on such an important issue. So with that, I'm going to be quiet, and I'm going to turn it over to Ravi.
Thank you, Pat. And Dr. Amiri and Dr. Prasad, thank you for taking time and making this so much easier to understand. And I think, as we all know, diabetes is a huge challenge in our community. And we hope to, looking forward to, this will be a discussion that we will take it and make Odessa eventually diabetes free. Nothing less than that. Okay.
So we'll get back together again, not this coming Tuesday, but the Tuesday after that.
Yes, sir.
So for all of you tuning in, tell your friends, tell your family members, and we'll see you week after next for some more wonderful discussion.
Thank you, Pat. Thank you very much.
Thank you. Thank you very much.
Thank you.